USA Health, University of South Alabama, and really excited to be able to hear. This is the first time we've heard from this great industry partner, Kloud 7, who made an incredible difference in the lives of the wonderful team at USA Health. We have Nick Seeger and Ahmed Jalal. They are joined by Michael Barlow. Nick and Ahmed, I'll let y'all take it away.
Thank you very much, Elizabeth. I really appreciate the introduction and the background. We are Kloud 7, and I'm the Chief Technology Officer, and Ahmed is our Chief Operating Officer. And we've got Michael Barlow, who is the Care Access Team Lead, who we've worked with quite a lot over the last few years and have built quite a relationship with from the standpoint of his team's needs.
Thanks, Nick. I appreciate it. And Elizabeth, thank you. I appreciate the opportunity to kind of tell the little story with Kloud 7 and USA Health. So for us, our story begins with the creation of our centralized referral team in October of 2020. So this is a call center team that processes incoming and outgoing referrals for our health system. We also process incoming requests for hospital discharge follow-up appointments from our hospitals. So when we began the team, we did not implement a call center telephony system, only the traditional office phone system provided by our telecommunications department. So it didn't take us long to realize we were facing some challenges for what we needed for the team or the call center to perform efficiently. We essentially faced 5 main challenges. We had a lack of visibility around the call center's overall performance. We had no analytics, reporting mechanisms, nothing like that with just the traditional office phone system. No comprehensive real-time view of the center's performance. And as the team leader, this hindered me from making any type of data-driven decisions, allocating team resources appropriately, and providing timely support to the team. Another challenge was quality assurance. That was a big concern for us because we wanted to make sure that we were providing the best service for our patients and our providers. So with no technology that offered any type of advanced monitoring or feedback mechanisms, we could not ensure consistent call quality and customer service. And again, as a team leader, I believed that this was resulting in inconsistent patient and provider call experiences and the overall loss of improvement in the team. Part of that, also capturing more calls or reducing lost call, where it was not a possibility. A traditional phone system like we were using has limitations on handling call volumes efficiently. So we were missing calls and potential service opportunities without any type of mechanism to handle this. We were already in the midst of the COVID-19 pandemic, kind of coming out of it somewhat. And with that, we saw the urgent need for remote work support. Also, it didn't take us long to realize that we needed to look at expansion. And our office or our call center was relatively small. So we, wanted to have the remote work support so that we could expand our team, allow for remote or hybrid work without actually making a physical move. So again, these factors led to our serious need for remote work. And lastly, we lacked overall operational efficiency. This included inefficiencies in call routing, reporting, administrative tasks needed to manage the call center's performance. I had no way to ensure the team was processing all calls as efficiently as possible and within our, USA Health standards of practice. So all these challenges were hindering our ability to deliver the best possible service to our patients and our providers. And as we realized the call center directly impacts our health system's reputation and bottom line, it did not, take us long to realize we needed to make a change with call operations. So we proudly chose to partner with Kloud 7. So I'll say, their technology surpassed anything we had originally experienced as far as phone operations. It met and solved, each of the challenges we were facing. First and foremost, Kloud 7's real-time analytics was a game changer for me as a team leader, giving me immediate insight into the center's performance and staff productivity. I was able to make data-driven decisions in real time to respond mainly to surges in call volumes and other staffing challenges that would come up. ensuring that we consistently deliver high quality service. Then Kloud 7's call recording and monitoring features made a big impact on our quality assurance needs as well as staff training. They have solid monitoring, whispering, and active call participation features that allow for great staff training, be able to listen to active calls with the trainee on the line, being able to step in if needed and coach the trainee along toward their success at being in the position. The recorded calls allowed us to be able to audit both new and seasoned staff to ensure quality of performance. This was definitely something we did not have in our traditional system, but needed urgently. So these features comprehensively not only have enhanced staff training, but also improved accountability, particularly with addressing complaints. Kloud 7's call metrics and reporting capabilities have allowed us to keep a close eye on key performance indicators such as abandonment rates, average call time, handle time, call service levels, etc. One particular report that I really like is the unreturned lost contact report. So when we have calls that are abandoned for whatever reason or missed, we actually have this report that we can utilize to go back, find those calls, and make return phone calls to them to, make sure that their needs are addressed. Sometimes they will call us back, but this makes sure that we do not miss a call. With Kloud 7's technology, our call center staff can now seamlessly handle call inquiries from anywhere with an internet connection. This flexibility has allowed, many of my staff members to move to remote work or hybrid work, and has been one of the biggest shifts in our system, allowing for our team expansion. And last but definitely not least, Kloud 7's automatic call distribution feature has transformed how we actually receive the calls coming into the system. So it's able to distribute calls evenly among our staff, reducing the out of time and optimizing our call center's performance overall. So again, thanks for listening. Thanks, Elizabeth. Thanks, Nick, for allowing me to have an opportunity to speak. And I will turn it back over to you now.
All right, perfect. And thank you, Michael. We learned so much in the work we've done over the last 10 years with other verticals, other sectors of business, that we're bringing a lot of that knowledge and skill to the healthcare sector. And over the last 4 years, we've really started building solutions that are dedicated to solve healthcare issues that we see occurring and hindering the performance of the healthcare system. Our goal as a communications platform, we would replace or extend the phone system that the healthcare system is currently using. And we are able to provide a single vendor approach. So you don't have to deal with 4 or 5 different vendors or 10 different vendors, as we've studied can happen, to accomplish an end-to-end communication solution with your patients and any other sort of inbound or outbound calls in the health system. We provide 24/7 on-site and remote support. So we back our product to the next level. And we have been working tirelessly to add many of these new enhancements. The first of which is our omni-channel contact center. This basically means you can communicate through our contact center with more than just a phone call or a voice call. SMS, email, chat bots that are based on the website. We would host all of those services and route those communications paths into the same teams that could handle it. The ability to manage multiple channels of communication from the same place ensures the absolute maximum amount of communication can occur with the various groups, but in an organized way. We've implemented some advanced routing features and advanced calling features that will automatically call patients back when a call is missed, or if they want to wait instead of waiting in queue, they can just push a button and the system will automatically call them back when it's their turn. Similar with SMS, if an agent's unavailable to receive their call, our system can automatically send them a notification to schedule an appointment or let them know someone will be calling them right back. Customer experience is our top priority with all these different solutions we've been creating. One of the biggest things that is a factor in the contact center space is user roles. Basically, we've got dashboards. So for our data analyst, we've got a dashboard that's just for seeing reports, analyzing trends, looking at call volumes and quality assurance metrics, seeing things from that perspective, health system wide or just over a certain department or division. We have our supervisor view, which is focused on someone who's engaged with a contact center, actively managing those agents, helping them, as Michael mentioned, if they have an escalation or they're having call performance issues. All of that is highly visible from our dashboards and can be turned into an actionable event. Agents are the third user type, and they have an interactive interface that is able to let them communicate. So they can receive calls, they can manage their calls, they can log data about their calls, and it helps them to move through those much more rapidly than a traditional phone type system. One of our key initiatives is quality assurance, and using artificial intelligence as an overlay with our call reporting platform that's included is the way that's our foundation in our quality assurance process. Every single call is screened, analyzed, and even the emotional sentiment, the words used in that call are trigger words to report it through a notification to the appropriate person and log it on a dashboard so it can be addressed. They're highly customizable because we know every health system, every department has different things they're looking for, and it's very easy to do. So you can track those sort of trends in real time. It's the whole customer experience of no matter which channel of communication you use, this is able to decipher that information and include that in this report. Our newest platform now, which is focused on dealing with complaints. This system will put all the complaints that come in into a real report, and it will group those complaints by the topic. So if it's a certain department or certain origin, it will automatically figure out what association should be used and present those. But those complaints actually can be managed from this dashboard too. So if there's a manager or supervisor over a department, they can make sure that they're being responded to and handled from one view, one single place. I think the biggest point there is we've got an application that is basically your phone. You can use it from anywhere. It's HIPAA PCI compliant communication, and it's able to integrate with all of the other solutions we have. If you are trying to use this and your health system's already using Microsoft Teams, for instance, we can actually integrate with Teams and you can have just one application for your communications needs instead of having to adopt our native application or something else to use for your software. Last but not least is what I think we're most proud of that is becoming available as we speak is our integrations with all the major EHR platforms. These integrations are focused on one priority, which is saving time for users and agents. This works in our clinical user roles and in our contact center user roles. When someone will call in to the health system, if they're in the database already, it will pull up their information, saving time on the front end of the call. It will automatically log interactions, file recordings, file SMS or chat-based communications with that patient's records. And on the end of the call, it's able to close out reports and automatically handle processes. It's fully HIPAA compliant and allows for all of that customization can be done based on what your needs are and how your health system wants to use this integration. So we've got a lot of exciting things that are coming that are derived from the work we've done with USA Health and our other customers over the years that we're excited to present today.